Hello, I'm Dr. J. Michael Bennett with the Founder Orthopedic Group. Today I wanted to introduce you to the ultrasound guided imaging that we are using for musculoskeletal complaints. If you think about musculoskeletal injury, many times we get plain x-rays to show us what the bone architecture or the bone structure is, and this is to evaluate for fractures or dislocations. If there ever was a soft tissue question, many times we would rely on our physical exam, and if we were suspicious, we would order an MRI. The MRI would cost money, it would require additional time, plus we would have to get the films back at our office for review and have the patient come back and discuss those findings. Technology has surpassed MRI technology now with the advent or incorporation of musculoskeletal ultrasound, which is a very exciting new realm of evaluation, and it's been helpful in incorporating this within our clinic in regards to musculoskeletal issues, particularly issues of the shoulder and elbow, and occasionally the knee. Some of the deeper joints are very hard to evaluate with ultrasound, and we oftentimes still need an MRI. As a matter of fact, if there's any question, we will look at with an ultrasound, and if there's a question, sometimes we'll order an MRI to confirm, but for preliminary screening, ultrasound is a great tool to have available. And right here is a GE Logic Eye, and I just show you a couple of pictures of what the ultrasound looks like and what we see when we're evaluating a patient. Okay, so this is the GE Logic Eye. This is our ultrasound probe here. This is the standard gel that we use. So we have a smaller probe, and just for example, I will show my elbow today. All this is jelly on the probe. The ultrasound works by sending sound waves in this direction, and the sound waves bounce off of different tissues. So when you start looking at the elbow, you'll have a different intensity based on whether you're seeing bone, tendon, or ligament or fatty tissue. So this here is an elbow joint. The white outline there is the bone, and I'm rotating my elbow back and forth, and that's the radial head rotating back and forth on the radiocapitellar joint of the elbow. A lot of times you can see tennis elbow very clearly using an ultrasound. Unfortunately, I don't have a hand to point, but you can see defects within the tendon. You can see where the tendon inserts. And right here, that's a normal looking tendon. The white line below the tendon is the bone. And I don't see any calcium deposits within the tendon. And the tendon looks intact. In a patient that's actually torn, you will see a big black spot in that area where the tendon's retracted. So this is very helpful in looking at tennis elbow, as well as other maladies of the elbow, in addition to the shoulder and occasionally the knee. Like I mentioned before, we're not very good at seeing deep within the joint, so we can't see meniscus tears or anything in the ball and socket mechanism in the shoulder joint, but it's good for looking at the superficial tendons. So if you'd like us to evaluate shoulder with an ultrasound evaluation, please let us know at your clinic visit. If you have any questions regarding this, please contact my office. I'm Dr. J. Michael Bennett. Thank you.